Hello everyone, my name is Paige Choka. I'm an international board certified lactation consultant working with Jan's Medical Supply. Today we are going to be busting some myths. We're going to talk about some common myths that many people associate with breastfeeding. So we're going to go ahead and talk about if this is fact or if this is myth. So let's go ahead and get started. One of the myths that I was most commonly asked was, can pumping induce labor? So this is a super common myth for most. The parameters on this really depends on if there's any complications for mom or baby. Is mom in a high risk situation? If so, it is definitely not recommended. If not, if this is a healthy term baby in pregnancy and there are no concerns for premature labor or any complicated infant or maternal medical factors, then no. The reason why pumping does not cause a mom to go into labor is because of the placenta barrier. So mom's own circulation and baby's circulation are actually separated when mom is pregnant. So the reason why pumping is not going to throw mom into labor prematurely is because it's not going to cross that placenta barrier. So this placenta barrier prevents all the exogenous and endogenous materials that a mom can have circulating in her system separate from her baby. So the reason why people think that pumping and nipple stimulation, even hand expression during pregnancy, can cause labor is because contractions is a cause and effect of a spike in oxytocin. Oxytocin occurs in many different ways for a pregnant mom. It can come from when she is really happy and relaxed. It's a love hormone. From sex, from nipple stimulation. So for the same idea that, a woman can go her entire pregnancy and have sex and be okay and not throw her into labor prematurely is because of that placenta barrier. The spike in oxytocin is not going to cross that barrier and it will not enter baby's system because there's a block. Now, let's say mom is already in the early stages of labor. That placenta barrier has weakened. So it is not as strong as it was in the second trimester or at 35 weeks. That barrier becomes weakened when mom transitioned from pregnancy to labor stage. So when mom is already in active labor, it is her body's biological time to start heading towards birth. Oxytocin can speed things up, but it will not cause labor, if that makes sense. So that's why a lot of people recommend for moms who are full term, who want to have their baby sooner, to go ahead and pump, to go ahead, take a nice relaxing bath, to go ahead, have sex. Those are the things that can help speed up labor once she has already entered the early stages of labor on her own. Those things can help speed it up. It's an assistance, but it's not a cause. Another question I received is breastfeeding an effective form of birth control? So the idea that breastfeeding is equivalent to birth control comes from the LAM method, the lactation amenorrhea method. For some women, this can be effective. Studies say if you follow this method exactly, it can be 98% effective. Alternatively, studies show if you do not have an external contraceptive plan, 85% of moms will become pregnant again within the first year of baby's life. A little bit of conflicting information. So the way that the LAM method works, basically 3 rules. Your baby has to be under 6 months old. You have to be exclusively breastfeeding consistently, where baby is not receiving any supplementation of any kind from any other device other than at your breast. And your period cannot have already returned. So with these 3 pillars, they say it is 98% effective. Anecdotally, I've heard this can be effective for that subset of moms, but it can be very hard to stick to this. And another issue with this method is if your baby starts sleeping through the night and is no longer following a regular 3-hour, 4-hour feeding interval, that can also impact your ability to have the effective birth control benefits. If you start your baby on solids early, such as 4 months, which is also not recommended by the Academy of Pediatrics and the World Health Organization, just a little tidbit. If you start solids early, or if you use formula supplementation, or if you're in a position where you are regularly away from your baby, this method is not going to work. Also, if you struggle with milk supply and you have to supplement so your baby gains the appropriate amount of weight gain per week, per month, per milestone, this also will not be an effective plan for you. It can be a birth control if you are consciously, consistently feeding full-time, exclusively, no other food, liquid, supplementation, solids, your period has not returned, and your baby is under 6 months. It can be effective, but there's a lot of room for error. So if you are someone who knows for sure you really do not want another baby right now, I would advise you to get an external alternative birth control plan to help you with your family planning goals. If you're someone who would be okay if you ended up pregnant, possibly, this might be an okay birth control method for the first 6 months. Another myth I received is, no matter what, pumping and breastfeeding is going to hurt and you will bleed. Myth. Anecdotally, I work with many moms who find breastfeeding and pumping comfortable. It is possible, and I will caution this first off, if you are in excessive pain where you are wincing, you are dreading feeding because of the pain, or if the pain level is more excessive than what you would feel if you're touching a bruise, that is a sign your body is telling you something is going on, something is wrong, we need help. So at that point, if you are feeling excessive pain, work with a lactation consultant so we can find the root cause of your pain. It is common, I see it often, where moms are in pain, moms are bleeding. Just because it is common does not make it normal or acceptable. It is not supposed to hurt. There is many reasons why a mom may feel pain during her pumping and breastfeeding journey. If it is breastfeeding, it is almost always due to a bad latch. That's why working with a lactation consultant is so important, because they will teach you ways on how to get a comfortable latch. A comfortable latch comes from a deep latch. This is the most common cause for a mom to feel breastfeeding pain. It's the latch. So essentially, when a baby is feeding just on the tip of the nipple, it is basically compressing the nipple, squeezing it. It's also rubbing on the hard palate of the roof of their mouth. So everybody has the hard palate, which is made up of bony cartilage. It would be painful for the tip of your nipple to be rubbed on that. If you go a little bit further back, you will feel a soft palate. It is spongy, squishy. That is where the tip of your nipple should be for comfortable breastfeeding. When this doesn't happen, it's when baby latches onto the tip of the nipple and there's not enough breast tissue in baby's mouth to draw and stretch the tip of the nipple to the soft palate. I can confidently say, more often than not, pain at the breast comes from a shallow latch. A lactation consultant can help you find ways to make it more comfortable, and how we can encourage baby to get a wider latch so they latch on more than just the very tip. They want more breast tissue so there is enough tissue to stretch that nipple to the soft palate. Now, if there is pain with pumping, most commonly that is a ill-fitting flange size. All pumps come with two standard sets. They're usually the 24 millimeter, and then Medela has the 27, Spectra and others have the 28 millimeter flange sizes. It has been 7 years since I've been in this field, and it is very rare for me to see a mom with a nipple that is actually a 24 millimeter size. So most often, it is the improper flange sizing. Also, the suction can be too high. The frequency can be too high. So there's a couple things with the settings that could be affecting the pump as well, or there could be some reason why pumping is uncomfortable, such as an autoimmune issue that creates excessive amounts of sensitivities in a mom. That is also something that you'd have to work with a lactation consultant, possibly your physician, to figure out what's going on. But in short answer, pumping and breastfeeding is not supposed to be painful. If it is, please reach out for some help. Here's another question. You can't take medicine when you are breastfeeding. Myth. You can take medicine when you are breastfeeding. Most medications are safe and compatible with breastfeeding. The main type of medications you should stay away from while you're breastfeeding are the ones that impact and affect your cognitive functions. So the main medications you're going to want to stay away from while you're breastfeeding are the ones that affect your cognitive functions. These are your analgesias, the ones that make you feel out of it and loopy. Those are the ones that also are known to cross the milk plasma barrier. What that means is these types of medications often can transfer from you to baby through your breast milk. Rule of thumb is if it affects your head, it can affect your milk. That is the main caution, that's the main group. There are other ones, of course, but that's very unique and specific. So your normal medications, for the most part, are not going to have, a high risk to baby if you were to take it, where they're going to be at risk for, adverse reactions or effects. So like your ibuprofen, your Tylenol, your vitamins, most herbal medicines are okay with breastfeeding. The biggest ones to watch out for are going to be your decongestions. Not because it's going to cause an adverse reaction for baby, but it will have a significant impact in your milk supply. So there are some types of decongestions that you can take that it will not have an impact on your supply, but you have to really look at the active ingredients to make sure that it has the correct active drug that will not impact your milk supply. So this is going to be your NyQuil. Dayquils are fine. Your NyQuil, your Sudafed, your Benadryl, etc. So the active ingredient in decongestions that you want to stay away from is pseudoephedrine. This specific active ingredient is known to quickly and rapidly lower your milk supply, especially if you use it regularly over the course of a couple days while you're sick. So that is the main ingredient in a lot of your Sudafeds. So, and any other decongestion. So that is a big no, but there are alternatives that you can take in place that will not result in a decrease of your milk supply. So the alternative active ingredient to pseudoephedrine is phenylephrine. This is an active ingredient that has the same result, but it's not going to impact your supply. Out of their loopy are the ones that likely the dumplings! America! Just gotta wait. We're fighting freedom right now. You're gonna want to stay away from while you're breastfeeding are the ones that affect your cognitive functions. These are your analgesias. How do you say it?
Analgesia.